The history of the first College of Medicine of the state of São Paulo is a reference in pioneering efforts, excellence in teaching, research, and healthcare. 1 century which today is translated into the country's largest hospital complex, formed by the Universidade de São Paulo Medical School and the Hospital das Clínicas, where 18,000 employees work in the assistance of millions of patients from all over Brazil and from other South American countries. A history that starts in the beginning of the 20th century in a Brazil which had only 3 centers for graduate medical education and lived in precarious health and hygiene conditions. Created with emphasis on research and laboratory practices, the São Paulo College of Medicine and Surgery was the first to offer students a scientific and experimental background. An innovative philosophy consolidated by the partnership with the Rockefeller Foundation, bringing to Brazil the American medical teaching model, with a limited number of seats for students, full-time classes, and the need for having its own hospital integrated to the set of laboratories to support the clinic teaching and research. The proposal originated the first school hospital in the country, Hospital das Clínicas, where hands-on classes were associated to research and healthcare activities. An initiative that in the beginning of the 50s allowed the college to be accredited by the American Medical Association a level A, the same level of the best medical schools in the world. The innovative spirit that marks the history of the Universidade de São Paulo Medical School was also reflected in the students' initiatives, who founded in early 1913 the Oswaldo Cruz Academic Center. In 1931, before being integrated into the University of São Paulo, the medical school inaugurated its headquarters in the Architectural Center, which 50 years later was listed as heritage property. The Universidade de São Paulo Medical School currently forms the largest hospital complex in the country, with 7 specialized institutes. The system also includes 2 auxiliary hospitals, the University Hospital, the Emílio Ribas Infectology Institute, primary healthcare centers, a healthcare center in Santarém in the state of Pará, and the São Paulo State Cancer Institute, first in the ranking of the User Satisfaction Survey promoted by the SUS, the Federal Public Health System, in 2010. Partnerships with entities like the Lucy Montoro Rehabilitation Network facilitate the assistance of disabled people or those with potentially disabling diseases. A structure strengthened by the action of institutions such as the Zerbini Foundation, which financially supports the Inquad Heart Institute, and the College of Medicine Foundation, created in 1986 by former students to manage the system composed of the Hospital das Clínicas and the USP Medical School. The educational model, completing 100 years, has become a standard of reference in the country's best teaching centers, and it transformed the USP Medical School into the main graduate center of Brazilian healthcare human resources. In medicine, physiotherapy, phonoaudiology, and occupational therapy, the college offers graduation courses, graduation enhancement and continuing education programs, and stricto or lato sensu post-graduation courses. It also offers the biggest medical residence program in Brazil, responsible for 14% of national research production in the medical area, about 4% of all national scientific production, and 2.2% of Latin America's research in all areas of knowledge. An enterprise complemented by nearly 200 research groups, which perform in the Medical Investigation Laboratories, or LIMS, responsible for the implementation of new techniques which represent scientific innovations in the medical area, saving thousands of lives. The the USP Medical School is classified among the 100 best in the world. In 2011, it was the first medical school in South America to integrate the M8 Alliance, a global network of academic institutions of excellence in teaching and research, which assists political, economic, and civil society decision makers to develop solutions based on science to improve life quality in the 5 continents. Guided by the same principles of innovation, excellence in teaching, healthcare, and medical research, the USP Medical School is proud of its past and is looking forward to its achievements in the next 100 years.